5 countries in East and Southern Africa are experiencing anthrax outbreaks, with more than 1,100 suspected cases and 20 related deaths reported since the start of this year. Now, a total of 1,166 suspected and 37 confirmed cases have been recorded in Kenya, Malawi, Uganda, Zambia, and Zimbabwe, where the disease is endemic with seasonal outbreaks every year, according to data reported to World Health Organization. Now, the outbreaks are presenting varied patterns in the affected countries. In Kenya, for example, 3 deaths have been reported this year, compared with 0 fatalities from over 200 suspected cases in 2022. While the disease is endemic in animals in Malawi, the country reported its first ever human case this year. Human anthrax cases have been reported in 3 districts in Uganda, with 13 deaths compared with 2 deaths in 2022. The high case fatality ratio is due to patients reporting late to health facilities. In Zimbabwe, human cases have been reported every year since 2019, underscoring the need for stronger preventive actions. So you see that the cases do present themselves in different facets in the different regions. Well, joining us to have this conversation is Maziko Matemba, community health professional in Lilongwe, Malawi. Maziko, thank you so much for joining us.
Thank you so much for inviting me to this important discussion.
It's a pleasure. Now, we see that outbreaks have become very rampant, especially on the African continent. We've been talking about different diseases, viral problems that are, just breaking out in these different regions of the African continent. Now, talking about anthrax, for example, what would you say are the root causes of the outbreaks, especially in the east and the southern part of the continent?
Well, I think there are a number of reasons, but I think as African countries, in terms of surveillance, we're still having challenges in ability to survey some of these disease conditions. But also, as you know, as Africans, I think you haven't invested much in the areas of animal in terms of the protection of animals and humans, because as you know, as a countries in Africa, we haven't put much emphasis in terms of resources. That's why you have seen most of African countries are still struggling to raise resources for the health sector. And if you go around Africa, if you look at the 2000 Abuja Declaration of 15% of national budget, there are very few countries in Africa which are invested in their health. Most of the African countries, their budget on health is around less than 10%. So coming these human and animal disease, I think it'd be difficult, because as you know that even our ministries, there's challenges in terms of sector ministries to be talking to each other, but also maybe coordinating each other. For example, ministries of agriculture, where animals are being managed, but also looking at the ministries of health and other ministries. So Africa have got a lot of issues in terms of coordination, financing, and others. Hence, we are not surprised that we're having all these conditions, because our investment is not that solid.
Right. Now, we also do understand that these outbreaks present varied patterns in the different regions. How exactly are the affected countries responding to the outbreaks, and what measures do you think are being taken to contain the spread of the disease?
For example, I think we have seen in Malawi, our Minister of Health produce a statement on this disease, anthrax, just to raise awareness so that the media and also other stakeholders can be aware that we have this condition in our facilities. So yes, indeed, maybe for African countries, what we have done is just produce statements. But in terms of investment in surveillance, because we need a very strong surveillance system for us to contain some of these conditions. I'll give you an example that we have public institutes, which the African Centers for Disease Control, that are trying to promote countries to have all those centers of excellence, so that they can be able to detect and treat, but also maybe to report some of these conditions. We have seen during COVID that I think these African Center for Disease Controls have been trying to make sure that our medical professionals are able to diagnose and report to some of these conditions in our facilities using these arms of films. So I think, yes, there's a lot to be done, but also the other challenge could be capacity, because as you know, you also need to have capacity in our countries to make sure that they can able to detect and report some of these conditions, but also looking at inter-country. How are the cooperation working? I know all of the organizations have been trying to make sure that the countries be talk to each other. We have committees which are able to share information and data. But as you know, most of the data in Africa is manual, is paper-based. There are very few countries who have gone digital. Of course, yes, WHO is trying to train to represent most of the countries to have a digital health in most of the countries so that we can return data to some of these conditions so that countries can be able to prepare and also maybe prevent some of these conditions.
Now, aside presenting statistics, is the World Health Organization doing anything to support these affected countries in managing the outbreaks?
Yes, I think I'll give an example that polio and other conditions. We have seen that the World Health Organization has been coming in to advise countries. But as you know, that the World Health Organization have got limited in terms of how they can influence countries because countries need to make sure they adapt to the guidelines and other information which come from the World Health Organization, like technical guidance to governments. So if governments, yes, indeed, they're taking this technical guidance from World Health Organization, but if those countries are not adapting those technical guidance, then it becomes challenging for most of the countries because countries need to be wary of what is happening. For example, most of African countries in a low income setting, normally they get their resources from the north, and most of them haven't gained the means of understanding why we need to have our own local resources because some of these conditions when they come, you need to make sure that our local systems are ready to be able to manage some of these conditions. But we see now most of the countries, they will wait maybe from the World Health Organization, then they also wait for other resources to be given by other developed countries. So that is what those weights, which maybe is bring some of these things, but also culturally, our culture systems in most of African countries, we haven't adapted enough to make sure that when we notice some of these conditions, we need to report immediately to our health authorities so that our health authorities can be able to start managing some of these conditions. So the African setting has got a lot of challenges. I'm hoping the coming of African Center for Disease Control will be an opportunity for African countries to be vigilant on some of these outbreaks.
Right. And what would you say are the economic and social impacts of these outbreaks in these regions, and countries across the continent that, the long-lasting effect it will have on these countries? What would you say those are?
The economic impact are huge because looking at most of the African countries, most especially lower income setting, we have seen with climate and
Matemba, are you there?
the economic impact is so huge. That's why maybe we have seen that most of the countries are still struggling and maybe to contain some of these conditions. But also, most importantly, in terms of how do we manage some of these things, you see that most of the countries are still struggling to raise enough resources to meet the demands of containing some of these conditions. But also maybe looking at these conditions, for example, anthrax is spread through animals. How many countries have invested in protecting animals from getting some of these diseases? You see that most of the countries in the ministries of agriculture, where I think most of these animals have been managed as a sector, how many of those maybe have gone to those sectors and be able to start managing those things? But also looking at currently that One Health, One Health approach is one of the approach which has been said time and again. I don't know how many African countries have started maybe managing, but also maybe be able to align to One Health approach, which is an approach which can be able to contain some of the diseases which are transmitted through animals to humans. So I think you can see now that I think we have a lot of work to go as African countries to make sure that we learn some of these things and be able to adapt quickly. Because I don't even know if we don't adapt, then we have challenges in terms of making sure that some of these conditions can be managed.
Now, in terms of vulnerability, you did talk about vulnerability, and I want us to explore that for a bit. In these regions, especially the countries that are experiencing the outbreak of anthrax, would you say that there are certain regions that are more vulnerable than others, to the outspread, to the disease in general?
Looking at anthrax, the outbreak, I think when it was diagnosed, you found that there are very few countries which I think reports are coming up. As there are countries you have mentioned, Malawi, Zambia, Kenya, and others. So I think we need to wait for more data. That's why I'm thinking as African countries, we haven't invested much into data so that that data can inform decision making. Because if your data is not well designed or trusted, then we might be able to have pockets of data which is coming up, which cannot inform much of the magnitude of the disease. Maybe we might have other countries who are having this much more than others. But if our data is not digitalized, we have seen the COVID, and most of the countries they did invest in data and in digital data, so that you can have real-time data which can be used. So there will be a lot of issues in terms of our data management and for decision making, which I believe as African countries, as an advocate, I've been trying. In fact, we are working with a health organization on digital health to make sure that, for example, for Malawi, it is digitized and making sure that our health workers, our health managers are able to work on this data so that they can be able to inform some of these conditions when they come. But also our robust systems in terms of data management on how the occurrence of these other new, we call the new diseases, which maybe they are not in our data profile. I think it's also an issue which we need to work on. How do we make sure that our data profile is also speaking to some of these conditions? Because the challenge which we're having at the moment, we have communicable and non-communicable diseases which are formatted in our data frameworks. But maybe some of these diseases like anthrax and others, maybe they might be. For example, we have seen cases where someone go to a hospital, is feeling weak, is have signs of a condition, but maybe a facility cannot know what type of a condition that one has. So in terms of our capacity, laboratory capacity to diagnose different type of conditions, be able to inform a decision, it's also challenging in most of African countries. That's why I'm saying the coming in of African Center for Disease Control is an opportunity. I'm hoping African countries will adapt so that we have real-time data, other than maybe allowing more data from much outside, which maybe might not inform them when they don't make decisions, more especially to the outbreak of some of these conditions.
Right.
But also, I've seen the of climate change has also created more of these challenges.
Okay. All right. Maziko Matemba, community health professional, Lilongwe, Malawi. Thank you so much for joining us. We do appreciate your time with us on the show.
Thank you so much for calling me. Thanks.
My pleasure. Well, this is where we call it a wrap on Village Square Africa. It's been a pleasure speaking with these gentlemen as we, dissected the issues that pertain to the African continent, from the spread of anthrax and, of course, to the power outage in Kenya and the solutions that can be preferred. Join us again in our subsequent episodes as we discuss.